Recording in progress.
Hello everyone. In this lecture, we are going to study about hemophagocytic lymphohistiocytosis. So if you see the term, in this condition, there will be phagocytosis. There will be phagocytosis of blood cells. Hemo implies the blood cells. Phagocytosis of the blood cells with the help of histiocytosis. The histiocytes. Histiocytes are nothing but activated macrophages. These are activated macrophages. So basically, in this condition, the activated macrophages will phagocytose the blood cells. Now, before understanding this topic well, first of all, we need to understand some of the basics of T lymphocyte activation and how macrophages come into the picture. So those basics has to be clear before going into this topic. Okay, so we'll just discuss briefly about the lymphocyte activation, especially the T lymphocyte activation. Okay, so as you all know, we have primarily we have two types of T lymphocytes. One is the CD8 plus T lymphocyte, which is otherwise known as the cytotoxic T lymphocyte, and we also have CD4 plus T lymphocyte, which is otherwise known as the T helper cell. Okay. First of all, we'll try to understand how the CD8 plus T lymphocyte or the cytotoxic T lymphocyte is activated. So if you see here, this is the CD8 plus T lymphocyte. Okay. First thing you need to understand is this T lymphocyte, CD8 plus cell, can only be activated if it recognizes an antigen which is presented by MSC class 1 molecule. Okay. So as you can see here, this is the MSC class 1 molecule which is presenting an antigen, and this antigen is recognized by the CD8 plus cell. Okay. So CD8 plus cell can only identify those antigens which are presented by MSC class 1 molecules. Okay. So if you see the structure of MSC class 1 molecule, it has two chains. One chain is larger, as you can see here. This chain is larger. It has three subunits: alpha 1, alpha 2, and alpha 3. So the larger alpha chain has three subunits: alpha 1, alpha 2, and alpha 3. And it also has a smaller subunit which is known as the beta 2 microglobulin. Beta 2 microglobulin. So this is the beta 2 microglobulin. Okay. So MSC class 1 molecule is made up of two unequal chains. Alpha chain, which is bigger, has three subunits: alpha 1, alpha 2, alpha 3. And it also has a beta chain, which is known as the beta 2 microglobulin. And you can also appreciate that the antigen binding cleft is present between alpha 1 and alpha 2. Okay. So if you see here, this is the antigen binding cleft, and this is present between alpha 1 and alpha 2. Okay. So it is important to understand this structure because we'll study about the MSC class 2 molecule that has a different structure compared to the MSC class 1 molecules. Okay. And I told you the CD8 plus T lymphocytes, they can only identify those antigens which are presented by MSC class 1 molecule. That is why these CD8 plus T lymphocytes, these are known as the MSC class 1 restricted. These are MSC class 1 restricted lymphocytes. Okay. Next thing is, this MSC class 1 molecule is present in all nucleated cells. It is present in all the nucleated cells and also the platelets And RBCs will not have this MSC class 1 molecules. So that is an important point to remember. Okay. So all the nucleated cells will have the MSC class 1 molecule, and also platelets will have MSC class 1 molecule. We have studied previously that platelets and RBCs will not have nucleus. However, platelets will still have the MSC class 1 molecules, but RBCs will not have MSC class 1 molecules. Okay. The next point we need to understand is this MSC class 1 molecule can present those antigens which are produced intracellularly. Okay. So MSC class 1 molecules can only present those antigens which are produced intracellularly. So if you see here, this is a cell which is producing some of the proteins, as you can see here. This protein is produced. After production of the proteins, the protein is produced after the process of transcription followed by translation. And once the protein is produced, this protein will have partial digestion in the proteasome. So the proteins will have partial digestion in the proteasome, which will make smaller peptide fragments. And after formation of these peptide fragments, these peptide fragments, or you can say the antigens. Now these antigens will be taken up into the endoplasmic reticulum. So this is the endoplasmic reticulum. These peptide fragments, or you can say the antigens, will be taken up into the endoplasmic reticulum with the help of a protein that is known as TAP protein. So this is the TAP protein. Okay. So what is the full form of TAP? TAP is transporter associated with antigen processing. Okay. So TAP protein is transporter associated with antigen processing. Okay. So this protein will take up the antigen into the endoplasmic reticulum. And inside the endoplasmic reticulum, these antigens can bind to the MSC class 1 molecule. Now that complex of MSC class 1 and antigen will come to the surface. Okay. And now this complex is ready to interact with the cytotoxic T lymphocytes because this antigen is presented with the help of MSC class 1 molecule. Okay. So till now we have discussed that CD8 plus T lymphocyte can only identify those antigens which are expressed by MSC class 1 molecules. And MSC class 1 molecule can only present those antigens which are produced intracellularly. Okay. So basically this kind of interaction is seen with the cells which are virus infected or which are neoplastic cells or the tumor cells. Okay. Basically, in this situation, the antigens are predominantly produced intracellularly. Okay. So as you all know, if virus is infected a particular cell, the viral genome, it can produce certain proteins. Similarly, if this cell is a neoplastic cell, the protein production, whatever proteins they will produce, these are mutated proteins. Okay. So those can be presented by the MSC class 1 molecules. And at this point of time, you might be thinking that, as I have told you, all the nucleated cells will have this MSC class 1 molecule. You might be thinking that MSC class 1 molecules will also present the self antigens. Yes, it is possible. It is possible that MSC class 1 molecule will present the self antigens. However, those self antigens, even though they are recognized by the CD8 plus T lymphocytes, the T lymphocytes will not be activated in those cases. Okay. So if CD8 plus T lymphocytes will recognize a self antigen presented by the MSC class 1 molecule, it will not be activated. It will not cause damage to those particular cell. Okay. So it will not cause damage to the self cells. Okay. So that is known as the mechanism of immune tolerance. Okay. So even though CD8 plus T lymphocytes can recognize self antigens expressed by MSC class 1 molecule, because we have discussed that MSC class 1 molecules are present on all the nucleated cells. So sometimes it is possible that a normal cell, okay, a normal cell in our body is presenting some of the normal antigens with the help of MSC class 1 molecule. Even though those antigens will be identified by the CD8 plus T lymphocytes, in those conditions, the cytotoxic T lymphocytes will not cause damage to that cell. And that is known as the mechanism of immune tolerance. Okay. And those things we'll discuss in detail when we'll discuss about the immunology. Okay. So I'll not go into those details. Okay. So especially the virus infected cells and the tumor cells, these cells will be recognized by the CD8 plus cells. And once the CD8 plus T lymphocytes, or you can say the cytotoxic T lymphocytes, once they recognize these virus infected cells or the tumor cells, they'll have various mechanisms to destroy these cells. Okay. Now, how exactly this interaction is happening? Now we'll try to focus more on that. As you can see here, this CD8 plus cell, it has a T cell receptor. With the help of a T cell receptor, it is identifying the antigen which is presented by the MSC class 1 molecule. Once this interaction happens, to further strengthen the interaction, the CD8 molecule, so this is actually the CD8 molecule. The CD8 molecule will come and bind to the alpha 3 subunit of the MSC class 1 protein. Okay. So the CD8 molecule can bind to the alpha 3 subunit of the MSC class 1 protein. Okay. So this will make the bond more stronger. Okay. Once this interaction happens, there will be signal 1 to the cytotoxic T lymphocyte. So this is the signal 1. If you see below, there is one more interaction happening between the affected cell and the CD8 plus cell. This interaction is happening between the B7 protein of affected cell and CD28 protein of T lymphocyte. B7 is otherwise known as the CD80/86. Okay. So basically, this second interaction is happening between the B7 of affected cell and CD8 protein of the T lymphocytes. And once this interaction happens, they will provide the signal 2 to the lymphocytes, to the T lymphocytes. Once the T lymphocytes get both the signal 1 and signal 2. Now they will try to produce some of the proteins. Okay, so there will be some of the protein production. Why this? Why they produce these proteins? Because they want to kill the cell. This cytotoxic T lymphocyte, they want to kill the affected cell. So that is why they will produce some proteins. These are, if you say for some examples, these are basically porphyrins and granzymes. Porphyrins and granzymes. Now, how these porphyrins and granzymes are going to kill this affected cell? I'll show that here. So if you see, this is the affected cell. Okay. Now these porphyrins will make pores. They will make pores in this affected cell. And these granzyme molecules, these are the granzyme proteins or molecules. They will go into the affected cell. And once they go into the affected cell, they will initiate the process of apoptosis. They will initiate the process of apoptosis. Okay. So once cytotoxic T lymphocytes are activated, they will produce porphyrins and granzymes. Porphyrins will make pores in the cells, in the affected cell, and the granzymes will go into the cell and they will initiate the process of apoptosis. Apart from that, the T lymphocytes can also produce Fas ligand. They can also produce Fas ligand, which can be recognized by the Fas receptor of the affected cell. And when this interaction happens, this will also initiate the process of apoptosis. Okay, so basically, there are various mechanisms by which the cytotoxic T lymphocytes can damage or can destroy this affected cell. This is how this T cell is functioning. This is how this CD8 plus T lymphocyte is functioning. Okay, but apart from this, these T cells, when they are activated, they will also produce some of the cytokines. Okay, and these cytokines, one of the important cytokines is interferon gamma. One of the important cytokines is interferon gamma, and these cytokines, they will cause recruitment and activation of the macrophages. Okay, so they will cause recruitment and activation of the macrophages. Now these macrophages can come and they can actually engulf, or you can say they can phagocytose the affected cell also. Okay, so basically CD8 plus T cells they will cause direct killing of the affected cell, and they can also activate the macrophages to cause damage to the affected cell. Okay, so these cytokines will cause recruitment and activation of the macrophages. There is another mechanism by which the CD8 plus T cell can activate the macrophages, that is known as the CD40 ligand and CD40 interaction. So basically, CD40 ligand will be presented by the cytotoxic T lymphocytes, which will interact with the CD40 receptor present on the macrophages. And through this process also, they will cause more and more activation of the macrophages. Okay, so this is how CD8 plus T lymphocytes are activated and they are functioning. Okay, so if you try to revise again, I'll just try to revise it again. So basically, the virus infected cells or the neoplastic cells, they produce some of the non-self proteins. Those proteins will be partially digested by the proteasome system to smaller peptide fragments. Those peptide fragments will be taken up into the endoplasmic reticulum with the help of TAP protein. Inside the endoplasmic reticulum, these peptide fragments, or you can say the antigens, will interact with the MSC class 1 molecule, and that complex of MSC class 1 and the antigen will come to the surface. Okay. Now this antigen will be recognized by the CD8 plus T lymphocytes because these are MSC class 1 restricted. So they can identify those antigens which are produced by presented with the help of MSC class 1 molecule. Okay. So once this cytotoxic T lymphocytes, they have identified the antigen, they will try to make a stronger bond between them. Okay. So now the CD8 molecule of the lymphocyte will interact with the alpha 3 subunit of the MSC class 1 protein, MSC class 1 protein. Okay, and this interaction will provide the signal 1 to the lymphocytes. Okay, the second interaction happens between the B7 protein of affected cell and CD8 protein of the T lymphocytes, and that will provide the signal to both these signals will cause the T cell, cause the cytotoxic T lymphocyte to be activated. Once they are activated, they will produce porphyrins and granzymes, which will help in apoptosis of the affected cell. Also, they will cause apoptosis with the help of Fas ligand, Fas receptor interaction. On the other hand, once these T cells are activated, they will also produce some of the cytokines, which will recruit more and more macrophages. Okay, and with the help of this CD40 ligand and CD40 interaction, these macrophages can be activated more and more. And once these macrophages are activated, they'll cause damage to the affected cells. Okay, so now if you understood the CD8 plus T lymphocyte activation, Now it will be slightly easy to understand how CD4 plus T lymphocytes are activated and how they function. Okay. So I have told you that CD8 plus T lymphocytes can only identify the MHC class 1 molecules. They are MHC class 1 restricted, and MHC class 1 protein can only present the antigens which are produced intracellularly. In contrast to that, the CD4 plus T helper cells, they can identify those antigens which are presented by MHC class 2 molecules, and these MHC class 2 molecules will present only those antigens which are coming from extracellular location. Okay, so MHC class 2 molecule cannot present the intracellular antigens. They will only present the antigens coming from extracellular space. Okay, so this is the basic difference between the basic difference between the cytotoxic T lymphocyte activation and helper T cell activation. Okay. Again, we'll try to start our discussion with the MHC class 2 molecule. So first of all, we'll see how it is different structurally from the MHC class 1 molecule. MHC class 1 molecule was made up of two subunits, alpha subunit and beta subunit, but they were unequal. Okay, alpha subunit was larger. But if you see here, MHC class 2 molecule is also made up of two subunits, alpha and beta subunit, but here both the subunits are equal in the length. So okay, so you can see here, this is the alpha chain. It has two subunits, alpha 1 and alpha 2, and it has a beta chain, beta 1 and beta 2, and you can see they are of similar shape. Okay, they are of similar shape or similar length. And here the antigen binding cleft is present between alpha 1 and beta 1. Okay, so in MHC class 1 molecule, the antigen binding cleft was between alpha 1 and alpha 2. In MHC class 2, it is between alpha 1 and beta 1. Okay, next thing is on which cells these MHC class 2 molecules are present. So MHC class 2 molecules, in contrast to MHC class 1 molecules, they are present only on antigen presenting cells. They are present only on antigen presenting cells. Very important point to remember. So antigen presenting cells are, examples are dendritic cells. Dendritic cells are classical prototype example for antigen presenting cells, or you can say they are professional antigen presenting cells. We also have various other antigen presenting cells like macrophages, B lymphocytes, but dendritic cell is the classical example. That is why I have shown here the example of a dendritic cell. You can see these are the dendrites. Okay, so MHC class 2 molecules are present only on the antigen presenting cells, and they can only present those antigens coming from the extracellular space. So you can see here, this is a cell. You can say this is a dendritic cell. First of all, it will endocytose the extracellular proteins. You can see these are the extracellular proteins. It can be some of the viral proteins. It can be some of the bacterial proteins. One point I want to make it clear. As you can see here, if a cell is infected with virus, as you can see here, if this is a viral genome, this viral genome can produce some proteins. Okay, and I have told you these proteins can be processed intracellularly, and it can be presented with the help of MHC class 1 molecules. But sometimes these proteins can come out of the cell. They can come out of the cells. And these proteins which are coming out of the cells can be taken up with the help of macrophages into the cell through the process of endocytosis. And with further processing, these proteins, these antigens can be presented with the help of MHC class 2 molecule also. So the thing, you should be able to understand that the viral proteins can be presented with the help of MHC class 1 molecule, and it can also be presented with the help of MHC class 2 molecule. Okay, so this is actually a confusing thing, which when we study for the first time, it's slightly difficult to understand. When we discuss about the MHC, when we discuss about those cytotoxic T lymphocytes, I told you that virus infected cells will produce intracellular antigens, which will be presented by the MHC class 1 molecule. But here again, I am telling that viral proteins can be presented by the MHC class 2 molecule, but the mechanism is different. Okay. In the first example, when we discuss about the cytotoxic T lymphocytes, these antigens, when they are present intracellularly, they will be processed with the help of proteasome system, and they can be presented by the MHC class 1 molecule. However, some of these proteins can come out of these cells, which will be taken by some other antigen presenting cell through the process of endocytosis. And after that, it can be processed and presented with the help of MHC class 2 molecules. Okay, so viral proteins in this condition, these are intracellular, but viral proteins in this condition, these are extracellular. Okay. So once these are endocytosed, these proteins, they will be fused with the lysosomes, and they will make the endosome. And with the help of lysosomal enzymes or hydrolysis, these proteins can be fragmented into smaller peptide fragments or antigens, and they can combine with the MHC class 2 molecule. This is the MHC class 2 molecule, and they can come into the surface. Okay, so I hope it is clear. So once this MHC class 2 molecule is presenting the antigen, the CD4 plus T lymphocyte can identify this. Again, the same things will be repeated, like the CD4 plus molecule will come and bind to the beta 2 segment or beta 2 subunit of the MHC class 2 molecule. And both of them will provide the signal 1 to the T helper cells, and the signal 2 by the interaction of B7 and CD28, that will give the signal 2. And with the help of this signal 1 and signal 2, the CD4 plus T cells will be activated. Okay, now these are activated. Now, once they are activated, they will try to produce some of the proteins. What are these proteins? One of the important protein, or you can say one of the important cytokine that this CD4 plus T cell will produce is interleukin 2. Interleukin 2. As you can see, these are the interleukin 2. This interleukin 2 has autocrine function. What do you mean by autocrine function? Autocrine function means these cytokines will act on the same cell which is producing the cytokine. Okay, so that is known as the autocrine function. So as you can see here, this interleukin 2 is coming out of the cell and it is getting attached to the interleukin 2 receptor which is present on the same cell. Why this is required? This is required for further activation and proliferation. More and more proliferation of this CD4 plus T lymphocytes. Okay, so this interleukin 2 which is produced by the activated CD4 plus T cell, this will cause further proliferation and division of the CD4 plus T helper cells. Okay, so basically they help in the proliferation. Okay, after that, the CD4 plus T cells can differentiate into various lineages. They can differentiate into various lineages. These are divided into Th1, Th2, and Th17 lineage. Important ones. Okay, so CD4 plus T cells, once they are activated, they will proliferate with the help of interleukin 2. After that, they will differentiate into various lineages. Okay, so I mean, to which lineage they will differentiate, that depends on what kind of antigen the T cell is exposed. Okay, depending on the type of antigen which is presented to the T cells, they will differentiate into a particular lineage. In this, to understand this lecture, I will not discuss about the Th2 and Th17 lineage. Okay, I will not confuse you more with more information. I'll just focus on Th1 lineage because that is what is required for this lecture. Other things we'll discuss when we study the immunology. Okay, so basically Th1 lineage will be activated only when the antigen which was presented to T cell is the antigen product of intracellular pathogen. Okay, like the virus. Okay, so viruses are intracellular pathogens. They will produce some of the proteins inside the cells. Those intracellular proteins will be presented with the help of MHC class 1 molecule to CD8 plus T cells. But some of those proteins can come out of the cell, which will be taken by some other antigen presenting cell. For that antigen presenting cells, those viral proteins are extracellular. Okay, so they can take up those extracellular proteins and they can present with the help of MHC class 2 molecule to the CD4 plus T lymphocytes. Okay, so there should not be any confusion. So intracellular pathogens can be presented to both CD8 plus T cell and CD4 plus T cell, and this is the mechanism. Okay, so if the CD4 plus T cell is identifying some of the proteins which are product of intracellular pathogen, they will differentiate into Th1 lineage. Th1 lineage. Okay. Now this Th1 lineage, this will produce some cytokines like interferon gamma. They'll produce cytokine like interferon gamma, and the rest of the things, you know, once they produce interferon gamma, there will be recruitment and activation of the macrophages, and further activation of the macrophages is also caused by the CD40 ligand. Okay, so further activation of the macrophage can also be caused by the CD40 ligand and CD40 receptor interaction. Okay, now this macrophages can come and they can actually destroy, they can phagocytose and destroy the affected cells. Okay, so Th2 lineage and Th17 lineage I will discuss later, not in this lecture. So this is how, because I want to focus on how macrophages are activated, because we are going to discuss about the macrophage activation and engulfment of the blood cells. Okay, so in both CD8 plus T cells, I have told you how the T cells are activated and how macrophages can be activated and they can come into the picture. And here also, when I discussed about the CD4 plus activation, and I've told you, if they go into the Th1 lineage, they can activate the macrophages, and macrophages are the ultimate warriors for in this lineage. Okay. So once we understood this basic concept, now we'll go to our topic of discussion, that is hemophagocytic lymphohistiocytosis. Okay. So again, we'll just revise what is going to happen whenever there is an intracellular pathogen like viral infection. They will produce some of the proteins inside the cell. Okay. And these proteins can be processed and expressed with MHC class 1 molecule to the CD8 plus T lymphocytes. Okay. Similarly, some of the proteins can come out of the cell. It can come out of the cell, which can be taken up by the antigen presenting cells through the process of endocytosis, which will be presented with the help of MHC class 2 molecule. So this is the MHC class 2 molecule. This is the MHC class 1 molecule. Through this process, they will activate the CD8 plus T cells and CD4 plus T cells, and ultimately, as I have discussed previously, they will cause activation of the macrophages. So this is what happens normally. This is what normally happens. Okay. So once this process is over, once the macrophages have done their work, once all the affected cells are destroyed, the macrophages has to be shut down. Okay, you have to shut down the macrophages, the activated macrophages. That shutting down is done by the help of, again, CD8 plus T lymphocytes and natural killer cells. Okay, I'll repeat it again. Whenever there is intracellular pathogen, there can be activation of both MHC class 1 molecule related CD8 plus T cells. There can also be activation of the CD4 plus T cells. These things we have already discussed. Once they are activated, I have also told you how they can activate the macrophages. Okay, so once macrophages are activated, they can come and they can destroy the affected cells. Okay, once they have done their function, someone has to put brake on these macrophages. This brake on the macrophages will also be this brake on macrophages is provided with the help of CD8 plus T lymphocytes and natural killer cells. Okay, so natural killer cells is another type of lymphocyte. Again, I will not go into the details of NK cells in this video. For the timing, you remember both CD8 plus cytotoxic T lymphocytes and natural killer cells will provide brake upon the activated macrophage once the function is over. This is what happens normally. But what is going to happen in patients with hemophagocytic lymphohistiocytosis? Okay, so what happens basically in this condition, as I have told you, the granule release and the cytotoxicity. I mean, granules means the porphyrins and granzymes. Okay, so granule release and cytotoxicity cannot happen. Okay, so because of various mechanisms, or you can say various mutations or various other cause, maybe some autoimmune cause, maybe some viral infections. So because of some of the mechanisms, this process of granule release and cytotoxicity cannot happen. So that means the CD8 plus T lymphocytes cannot destroy this affected cell. It cannot destroy the affected cell because it doesn't have the activity of porphyrins and granzymes. So basically, the CD8 plus T lymphocyte cannot damage the affected cell. It cannot damage the affected cell, but it can produce more and more cytokines. Okay, so CD8 plus T cells are activated, but they are not functional. They are activated, but they are not functional because they are not able to damage the cells. Okay, however, they can produce cytokines. So they will produce more and more interferon gamma. They will activate more and more macrophages. So the macrophage activation is significantly increased in this condition. Okay, and on the other hand, you can see the brakes that are produced by the CD8 plus T cells and NK cells. Now these brakes cannot be produced. Okay, because NK cells and CD8 plus T cells, they are going to damage the macrophages with the help of these granules, with the help of those porphyrins and granzymes. Okay, and we have discussed that these porphyrins and granzymes are, there is some defect in that pathway that they will not be able to use those porphyrins and granzymes. Okay, so that is why NK cells and CD8 plus T cells, they are not able to apply brake on these activated macrophages. So on one hand, there will be activation of the macrophages, and on the other hand, there will be no brake on the macrophages, no brake on these activated macrophages. So that is why here in this condition, there will be more and more macrophage activation, more and more macrophage activation. Okay, so that is why the name lymphohistiocytosis. Okay, hemophagocytic lymphohistiocytosis. Now these activated macrophages can come and they can engulf, they can phagocytose the normal cells. Okay, so in this condition, what happens? The CD8 plus T lymphocytes and macrophages are activated. These are activated. Okay, and I have told you the CD8 plus T cells are activated, but they are not functional. So the functionality of CD8 plus cells and NK cells are reduced. their functions are reduced, but CD8 plus T cells are activated. And also macrophages are activated. So this is the basic concept behind HLH that you have to understand. Now, what are the causes? If you see, there are some familial causes. There are some familial causes. Like if there is a mutation in the protein, which is, if there is a mutation in a gene which is producing porphyrins. The example is PRF gene. So PRF gene is the gene. The protein product of this PRF gene is porphyrin. So if there is mutation in the PRF1 gene, the T lymphocytes or the NK cells, they cannot produce porphyrins. They cannot cause their cytotoxicity. They cannot they cannot have the cytotoxicity function. Okay, so PRF1 mutation is the classical example, which will cause familial HLH. Similarly, in patients with cardiac legacy syndrome, okay, cardiac legacy syndrome we'll discuss when we'll discuss about the qualitative disorders of WBCs. In that condition also, because of various mechanisms, they are prone for HLH. And there are some acquired causes. There are so many acquired causes. I'll not discuss everything. But the important one to remember is viral infection. Classically, the Epstein-Barr virus infection is classical. It's notorious to cause HLH. Similarly, many connective tissue disorders, they can cause HLH. And in connective tissue disorders, this HLH is known as macrophage activation syndrome. Okay, so basically, HLH and macrophage activation syndrome, they are synonymous. This terminology is used if HLH is seen in patients with connective tissue disorders like SLE or rheumatoid arthritis, those things. Okay, and other classical example is T lymphomas. Okay, so T lymphomas, there are various T lymphomas. We will discuss them separately, but various T lymphomas, they are also associated. They are also increased risk of HLH. Okay. And of course, there are so many other causes. I'm not going to discuss all those things. These are some of the important causes that can cause HLH. And the mechanism now we have understood. Now we'll see what is the consequence of this significant macrophage activation. So if you see here, this macrophage is activated. This is activated. Now it will try to engulf the normal cells. So basically the normal blood cells. So if you see, it is engulfing the normal cells. So this is actually activated macrophage, or you can say histiocyte, which is containing the normal cells. So if you see the histopathology picture, you can see this is the macrophage which is containing the normal blood elements, which has engulfed the normal blood elements. Okay, so this is example of hemophagocytosis. This is hemophagocytosis. Okay, now what is the consequence of this? So because it is damaging all the blood cells, it is going to cause pancytopenia. It is going to cause pancytopenia. And of course, these macrophages, they are mostly present in the reticular endothelial system. So basically, this increased macrophage activation will be seen in spleen, liver, and bone marrow. Spleen, liver, and bone marrow. So basically, these patients will also have hepatosplenomegaly. They will have pancytopenia. They will have hepatosplenomegaly. Also, these activated macrophages will produce various cytokines. Like again, it can also produce interferon gamma. It can produce the tumor necrosis factor alpha. It can produce interleukin 6, interleukin 12, and various other cytokines. Okay, these activated macrophages can also produce various cytokines. These cytokines, they will have various functions. They can cause bone marrow suppression, which will again contribute to the pancytopenia. And also they will be associated with systemic inflammatory response syndrome. Okay. So whenever there is widespread cytokine activation, widespread cytokine storm, it can cause a systemic inflammatory response syndrome, which if uncontrolled and if it progresses, it can ultimately cause multi-organ dysfunction syndrome, shock, and death. Ultimately, it can result in death. Okay. And also, whenever there is systemic inflammation, you will have features of systemic inflammation, like there will be increase in serum ferritin, and also there will be fever. Okay, so serum ferritin is actually an acute phase reactant. This we have discussed when we discussed about the iron metabolism. It's an acute phase reactant. So whenever there is systemic inflammation, this ferritin is going to increase. And particularly in this condition, ferritin is significantly elevated. Also, these patients will have fever and some other biochemical abnormalities like increase in triglycerides and reduction in fibrinogen. So these are various other things that you can find in these patients. Okay, and also we can understand that this is a life-threatening condition because this uncontrolled cytokine storm can result in systemic inflammatory response syndrome, ultimately leading to MODS, that is multi-organ dysfunction syndrome, shock and death. Okay, so what is the diagnostic criteria? Either if you find a known mutation, that itself suffices the diagnosis, or if you do not find a known mutation, if you are not able to do a mutation testing, there is a criteria 5 out of 8 of the following things has to be fulfilled. What are these 8 things? The first one is clinically the patient should have fever, organomegaly, especially splenomegaly. These things are clinical. Then on normal routine investigation, the patient should have bicytopenia. Okay, so at least 2 blood cell lineages to be affected by cytopenia. Then other biochemical parameters like increase in serum ferritin, increased serum ferritin, or increased triglyceride bar reduced fibrinogen. Then other things like biopsy showing hemophagocytosis, as I have shown you in the previous image, biopsy showing hemophagocytosis. Okay, then increased soluble interleukin-2 receptor. This is otherwise known as the CD25, or decreased NK cell activity. Decreased NK cell activity. These 2 things are difficult to do routinely, but other things can be done. And if 5 out of these 8 criteria are present, that also suggestive of diagnosis of, that is also compatible with diagnosis of HLH. Okay, so this is how this condition is diagnosed. And if you see treatment wise, if it is familial HLH or if it is a primary HLH, you have to give immunosuppression, because whatever the things that are happening, that is because of the increased immune activity, increased cytokine production. So you have to give immunosuppressions, especially to suppress the interferon gamma production. That is how we can actually suppress the macrophage activation. So we have to give immunosuppression, especially we give steroids, especially we give dexamethasone steroid, and also we give etoposide, cyclosporine, and various other things. I'm not going to those details. But if it is secondary, in those patients, we can give, you have to treat the primary cause, treatment of the underlying cause. If it's an infection, you have to treat the infection. If it's a malignancy, you have to treat the malignancy. So you have to treat the underlying cause. Okay. And of course, if nothing is nothing is responding, you can take up the patient for hematopoietic stem cell transplantation. Okay. So this is in a very briefly, outline of the treatment. But this is how the disease, actually this is a life-threatening condition. As you can see, it will have a severe, profound cytokine storm. If it is not identified and treated properly, it can cause death. Okay, so that is all about the hemophagocytic lymphohistiocytosis.